Hi everyone, this is Dr. Sangeeta Chaudhary again and I welcome everyone to my lecture class. In my today's class, I'm going to talk about the interpretation of ABG. What is ABG? We all know that ABG means Arterial Blood Gas. So there are different conditions when we need to do an ABG and we need to interpret the ABG to find out the acid-base disorder. So let's see how do we interpret an ABG and find out the diagnosis. Now there are certain steps for the analysis of ABG. Let's look at the steps. The first step is what is the pH? From the ABG we need to identify the pH, whether there is acidemia or alkalemia. The next step, we need to know what is the primary disorder. Okay, from the ABG we can identify what is the primary acid-base disorder. The third step, we need to find out if there is appropriate compensation. Whenever there is an acid-base disorder, our body will try to compensate for it and will try to maintain the balance of acid and base. So we need to find out if there is compensation, the compensation is appropriate or not. In the next step, we need to find out the anion gap. We need to find out the anion gap because there are conditions where anion gap increases. There are conditions where anion gap is normal or it reduces. So, it is important to find out the anion gap in order to identify the specific disorder. Next step, if there is an anion gap, we need to check for the delta anion gap or delta gap. Lastly, clinical correlation and establishment of the etiological diagnosis is very important. So now, let's talk about the different steps of ABG analysis. Before going to the steps proper, we need to know the normal values of different parameters of an ABG. Now, what is the normal pH? Normal pH is in between 7.35 to 7.45. If it goes below 7.35, we call the condition as acidosis. If it goes above 7.45, we call it as alkalosis. Okay, so this is what we need to remember, that the pH normal range is in between 7.35 to 7.45. Now, the range of PCU2 is 35 to 45. Bicarbonate range, it is in between 22 to 26. Anion gap, normal anion gap is in between 10 to 12. And then we need to know about the albumin also. Normal value of albumin is 4. Why we need to know the albumin? Because when we calculate the anion gap, there is something known as corrected anion gap. Okay, so for the calculation of corrected anion gap, we need to know the albumin value. Okay, so this is about the normal range of different parameters in ABG. Step 1, as I said, look at the pH. If the blood pH is below 7.35, this is acidemic, or if it is above 7.45, then it is alkalemic. In the next step, we said we need to find out the primary disorder. Okay, so what is the primary disorder? In this step, I just need to mention that, just remember that if it is a respiratory disorder, okay, if it is a respiratory disorder, then the direction of pH and the direction of PCO2 will be in opposite direction, means the change of pH and PCO2 will be in opposite direction. But for the metabolic disorders, if it is metabolic acidosis or metabolic alkalosis, the direction of change of pH and the direction of change of bicarbonate will be in the same direction. So let's see. Respiratory acidosis, pH is low and PCO2 high. The direction is opposite. Respiratory alkalosis, pH is high. Since it is alkalosis, pH will be high, PCO2 low. Again, the direction is opposite. As I said, respiratory disorders, the direction of change of pH and PCO2 will be in opposite direction. Now, look at the metabolic disorders. For metabolic acidosis, pH is low, bicarbonate is low, it is in the same direction. For metabolic alkalosis, pH is high, bicarbonate is also high. So the direction of change of bicarbonate and the pH is in the same direction for metabolic disorder. So this is how we identify what is the primary disorder present. In the next step, as I said, we need to know whether the compensation is appropriate or not. Now, how do we identify the exact compensation? There are formulas by which we need to identify, or we can identify the exact compensation. So, from this chart, we can identify the compensation is exact or not. So just look at the formulas for finding out the compensation. For metabolic acidosis, as the name suggests, metabolic acidosis means pH will be low and bicarbonate will be low. So as a compensatory mechanism, what body will try to do? Body will try to, our respiratory system will try to exhale more of carbon dioxide. That means it will try to remove carbon dioxide from the body so that PCO2 becomes low. So what will be the PCO2 value? PCO2 value will be bicarbonate value plus 15. There are three formulas, 1, 2 and 3. Okay, I am saying the third one because third one looks a bit easier. Okay, metabolic alkalosis means pH will be high, bicarbonate also high. Now in this case, respiratory system will try to conserve more of carbon dioxide as a compensatory mechanism. So PCO2 will be high. How much high it will be? PCO2 will be bicarbonate value plus 15. Again, there are three formula, 1, 2 and 3. The third one is kind of easier. Now, next is respiratory disorders. For respiratory alkalosis, it can be acute or chronic respiratory alkalosis. For acute respiratory alkalosis, bicarbonate will fall by 0.2 unit for per unit decrease in PCO2. For chronic cases, bicarbonate will fall by 0.4 unit for per unit decrease in PCO2. Respiratory acidosis can again be acute or chronic. For acute respiratory acidosis, bicarbonate will rise by 0.1 for per unit increase in PCO2. For chronic cases, bicarbonate will rise by 0.4 for per unit increase in PCO2. So these are the formula to find out how much is the compensation. Now this is a chart or table which we need to remember. We need to by heart this. Okay. Next step, as I said, next we need to calculate the anion gap. How to calculate the anion gap? Anion gap means sodium minus chloride and bicarb. Normal anion gap is in between 10 to 12. As I said before also, we need to find out the corrected anion gap. How do we calculate the corrected anion gap? The measured anion gap plus 2.5 multiplied by 4 minus albumin. So this is the formula to find out the corrected anion gap with the help of serum albumin level. Now, if there is an anion gap, then calculate the delta anion gap or delta gap. That is the next step. Why it is important? To determine additional hidden metabolic disorders. Okay, non-anion gap metabolic acidosis or metabolic alkalosis. If there is no anion gap, then start analyzing for non-anion gap acidosis. Right? Next is the calculation of delta gap. So this is the formula how we calculate the delta gap. When to suspect mixed acid-base disorder? It is not necessary that every time there will be only a single primary disorder. There may be combination of primary disorders, which is known as mixed disorder. Mixed disorder means independent coexistence of more than one primary disorder, as I just now said. If actual compensation is more or less than the predicted, then we can think of a mixed disorder. Okay, that means we need to calculate the compensation. If the compensation is more or less, or if there is no compensation, then we can think of a mixed disorder. And if the anion gap excess is more than bicarbonate deficit, then also we can think of a mixed acid-base disorder. So these are the hints by which we can think of mixed acid-base disorder. Now lastly, how we interpret an ABG means the example of an ABG interpretation. So in this patient, sodium was 140 by ABG, potassium 4, chloride 91, bicarb 33, PCO2 38 and pH 7.55. pH 7.55, that means the patient is having alkalosis. Okay, because it is more than 7.45, and I said if it is more than 7.45 means patient has alkalosis. So here this patient is having alkalosis. Now look at the bicarbonate value. Okay, bicarbonate value has increased. Here pH has increased, bicarb has increased, because the value of bicarb was, normal value was in between 22 to 26. So it has increased here. So since pH has increased and bicarb has also increased, that means this is a case of metabolic alkalosis. As in the previous slides, I said for metabolic disorder, the change of pH and bicarb will be in the same direction. Now, To find out the compensation, look at the PCO2. How much is the PCO2? PCO2 is 38. We know the normal value of PCO2 is in between 35 to 45. Right? 35 to 45. So here, if there was compensation, then PCO2 would have raised. Okay. But there is no raise in PCO2. So in this, we can think of a mixed acid-base disorder. Since PCO2 has not increased, it was supposed to increase as a compensatory mechanism, but it has not increased. That means there is component of respiratory alkalosis as well. Okay, so this ABG is a combination of metabolic alkalosis as well as respiratory alkalosis. So this is how we basically interpret an ABG. I hope this class was helpful, and now you can really interpret an ABG very easily. Thank you so much for attending my class.